There's a lot of very dedicated people.
I think you just hinted at one of the easiest analogies. Who's at the table?
Like my dad said, log and always be worth more than you're being paid.
We're going to have 30,000 more people here in the next 10, 12 years.
I am optimistic that we'll continue moving in the right direction.
And that takes finding people that wake up every day and they're thankful and they believe they can change the world.
This BendBeat discussion is brought to you by the Ladd Group, Ben's leading real estate team. So today on BendBeat, I'm honored to have you. We've got Megan Haase from Mosaic. Thank you for joining us.
Thanks for having me.
Yeah, this will be a lot of fun. So the longer I've been at Bend and the more that I've discovered about the role of Mosaic in our community, I'm continually surprised by kind of the breadth and depth of what you provide. And so I'm really excited to kind of unpack that for myself and our listeners today. Yeah, so Megan, tell me a little bit about the name. Where'd the name come from, and does it represent an effort or a mission for your organization?
Yeah, I love that question because we have a story about that. So in the beginning, as each clinic came to life, they had their own name, and the idea was to name the clinic as something that was reflective of the community it was in. But then we realized that people didn't understand that this was a system. It was more just individual clinics in each community. So our board came together and went through a process to find a name that could really reflect who we are and what we were going to become. And we started with Mosaic Medical, and the Mosaic spoke to everybody because it is a bringing together of people and communities and making this beautiful picture of what we're doing in the community and who we're serving. And then as we continued to evolve and add different services, folks were like, well, medical doesn't really tell what we are. And so we went through another process and came up with Mosaic Community Health, which really captured what we are in the community.
The broader scope.
The broader scope and the services, and that sense that we are here for the community. We are a place you can come and be part of this amazing system and feel like you really belong somewhere.
To get started, just kind of a background on you. You're a functional nurse practitioner and the CEO of Mosaic Community Health, correct? And so Mosaic is Central Oregon's nonprofit, federally qualified health center, and you serve Bend, Redmond, Prineville, Sisters, and Madras?
Yes.
Okay, big scope. And so you've been involved since the early days, right?
Yeah.
Early 2000s. Can you let me know kind of how that trajectory started? Because originally you were a provider with Mosaic, and now you're the CEO. You know, what did that arc look like?
Yeah, I came as a new grad family nurse practitioner, and I knew I wanted to be part of a community health center model. I had done that in my training, and I just was so drawn to the whole person health approach to care and serving everybody.
Yeah.
And so when the clinic was opening, there was a position, and I threw my hat in the ring, and they chose me along with another nurse practitioner who'd been practicing in the community. And we just kicked off this amazing journey, which started very grassroots in the beginning. We were in a tiny little modular building, and in the first 3 months, we served about 600 patients, and it was just a really special time. But the need that was in Prineville at the time was certainly all across Central Oregon.
Yeah.
Health centers were founded in the 60s and new to Central Oregon in 2002. So we quickly spread across all of Central Oregon. And during that time, I found that I really loved thinking about the system of healthcare, and it's broken. It was very broken back then, and being in roles that I could influence the system was starting to become really interesting to me.
Yeah.
And I loved seeing my patients too.
Yeah.
So we had a transition of our CEO, and I had been in a clinical leadership position, and they needed some interim support. And I'm like, okay, I can help, and let's see how this goes. And then I discovered that in that role, I could have even more of a system impact, and threw my hat in the ring again. And then they chose me to be the CEO back in 2010 or 11.
Oh, wow. So you saw it from the beginning, serving 600, and just before we started, you mentioned you're now serving 36,000.
Yes.
36,000 communities, Central Oregonians.
People in Central Oregon, and it's about the size of the city of Redmond.
One out of 8 people are being served by Mosaic. And I think I really want to help people unpack kind of what what Mosaic is, but you started with the phrase, and correct me if I'm wrong, you said whole person care.
Yes.
Define what whole person care means.
So for me, especially when I was a provider, I realized that people have a lot going on in their lives, and the challenges that come medically are just a piece of what they're experiencing. And so at the community health center at Mosaic, we have the ability to address more than just medical.
Okay.
So we have behavioral health, we have nutrition, we have community health workers that help with those basic social needs, which are really, really important for people to be on their health and well-being journey.
Okay. And so I guess, who is Mosaic for? And how does it differ from the standard providers that we see of St. Charles or Summit or things like that?
Well, we're a nonprofit,
Okay.
based nonprofit. So all the resources that go back into the community. Community health centers, there are over 1,500 across the United States, are here to be the safety net for a community. So we serve anyone and everyone, but we are especially designed to serve folks that have high needs.
Okay.
So a lot of our patients are living at or below the federal poverty level. We have the ability to have more robust services, especially for the Medicaid population, which is living at or below the federal poverty level, because we do receive some enhanced payments.
Okay.
And that lets us build out more of the structure to be able to take care of patients in this more holistic way, which is so critical for people living right on the edge.
So whether or not someone has medical insurance, Mosaic's there for them. And so where does that funding come from? Is this something a standard provider can't afford to support? Is their model not built out, for this? And I guess where does that funding and, to that role that you fill seems awfully essential. How is that sustainable for Mosaic?
Yeah, I think that's the nice thing about Central Oregon is we have this really strong healthcare ecosystem.
Yep.
And all of us are built to serve different populations. And for a community health center, we do receive the enhanced payments for Medicaid patients. We also have uninsured patients, and we have a sliding scale, so we're able to serve them at the cost that is right for them, and it's discounted. And if someone has a big hardship, we have hardship waiver processes for them. We do take all insurance coverages, but we have more of the safety net population, more of the Medicaid population, uninsured, or Medicare folks that are living on very fixed incomes. That's another part of the community that we're able to serve.
Yeah, so an awfully essential role. I mean, if you're serving 1 out of 8 Central Oregonians, I think without Mosaic, there's a pretty big hole in the Medicare system.
In Medicaid, yes.
Medicaid.
Yep.
And so how much of your funding comes from Medicaid and federal funds versus, fundraising and insurance, things like that?
Yeah, our Medicaid revenue is probably about 65% of our overall revenue coming in.
Okay.
And then we do have commercial patients, and so we bill like other clinics commercial. We have Medicare patients, and we receive a fixed rate for Medicare. And then we have our federal grant, which allows us that designation, which is about $4 million. And then we're able, as a nonprofit, we can do fundraising. We get grants from foundations and the federal government that helps us with certain programs as we continue to develop and grow different services for the community.
Well, and speaking of different services, I think, there's a lot of areas that you go into that traditional medical providers don't. I actually went to one of your fundraising luncheons where there was the video of the mobile units. Can you tell me a little bit about that?
Yeah, many years ago, we adopted a small mobile unit from the Central Oregon Veterans Alliance, who at the time was doing mobile care. And they realized that really a healthcare provider might make more sense. So we were able to adopt that from them. And we were going out and serving people that were unhoused and discovered this enormous need that was growing. And so we were able to fundraise and get our big mobile that some folks might have seen around town. And then in the last year to year and a half, we were awarded a Street Medicine Institute grant, one of 2 in the nation, and that comes with some consulting services to help us actually go out and do street medicine. But we really think about it differently, more outreach medicine, because we're not going to the streets, we're going to the forest. And we were able to get funding from the city to get 2 vehicles now that four-wheel drive and a sprinter and a truck that can go out and meet people where they are and serve them to make sure they're getting their healthcare needs met, because it's really challenging when you are without housing and that stability to be able to get your healthcare needs met.
Yeah, I mean, I would assume no one else is out delivering medical care to them. I mean, what is let's paint that picture a little more. What does that look like, as far as providing medical support to someone that is unhoused? I mean, are you their only point of contact? I mean, does it go beyond just, medicine and checking in? I mean, I assume this is a pretty critical interaction that otherwise wouldn't be occurring.
Yeah, the county has folks that go out there piloting street psychiatry, which has been great to have out there as well. And our substance use team is going out and also helping meet people where they are and help them with their substance use needs, which has been amazing.
Yeah.
I went out with the team, and it was you go out and you meet people where they are and are able to help their healthcare needs. One example was a woman had a heart condition. She needed to have a heart monitor, so our community health worker was able to bring out a heart monitor that she could put on and wear for the 2 weeks, and then we would take it back and then get her transportation to have her cardiac follow-up.
Yeah.
And without us out there, none of that would have happened.
Yeah. Well, and so, but you're in a lot of different pillars. I read some things about, school-based health centers, or partnerships. Tell me a little bit about that as well.
So we have 7 different pediatric sites. 6 of them are within the schools, and it's been a wonderful program partnering with the county and the school district to bring healthcare right to where the kiddos are. Any kid can come into any of the school-based health centers, but they certainly serve the population at the school. We also partner with Deschutes County, and there's behavioral health on site too. And we know that the behavioral health needs in our youth have gone up significantly past the pandemic, and having behavioral health embedded right there with the primary care is just an amazing resource for these schools and their families.
Wow, that's amazing. So you're involved in 6 schools at this point?
Yes.
Wow. And so that's not services that has otherwise been provided. I mean, historically, healthcare in the school system is emergency healthcare, correct?
Yeah. Yes, and in Central Oregon, there has been school-based health centers in other parts of the state, but in Central Oregon, that wasn't as common. There were a little bit of starts early on, but this is the more robust program that we've been able to provide in our region, which has been great.
Well, that's awfully important. I mean, young people have really had a tough go in the last decade or two, from the way they interact with social media, and then with COVID and the pandemic. I would assume that even just starting with mental health with young people, I think it's a pretty acute need right now.
And you want it to be incredibly accessible, like barrier-free access to mental health.
Yeah.
I was at the City Club forum yesterday, and it was on mental health. And one of the things that was highlighted is the programs for youth are really under-resourced here in Central Oregon. So any way we can get to these kiddos with services is really critical.
Well, so obviously we're talking about mental health and primary care, serving people mobily, and what we've done and what you're doing in the community for everybody. But what's the through line on that? What's the central mission, or the mission statement, or the biggest goal that your North Star for Mosaic?
I think our biggest goal is providing access to all of these robust services that we have within Mosaic. And we have a strategic plan that has a growth objective to bring in more community members to these services. And we have hundreds of patients coming in our doors, new patients every month. But we need to continue to grow because the need feels almost endless.
Yeah. What gives you hope on being able to sustain the level of service that you're providing, given the fact that it's probably increasing on a daily basis?
I think that we have, I feel like at Mosaic, it's part of what inspires me is the people that work there come to work and be part of this mission and serve the community in this way.
Yeah.
And I also feel like we're very planful and strategic, but listening to the needs of the community and then putting our resources back into our growth, whether it's growth to provide more access or growth to offer more services.
Yeah.
And we've been able to do that consistently since 2002 when we opened.
Yeah.
So we will continue to grow and meet that need over the years.
So when someone looks at Mosaic and starts to understand that important hole that you're filling in our community, how can they best support Mosaic? Would it be beneficial for them to use you as a provider? Would it be beneficial for them to donate, to volunteer? How could people best get involved with Mosaic?
Yeah, I think that part of it is me sitting with you
Yeah.
and sharing our story, because when I'm out in the community talking with folks that haven't used our services, they don't fully understand what this resource is in the community and what we're providing to create this part of this ecosystem that's really essential for a healthy and thriving community.
Yeah.
And so I think getting the word out, and then yes, there's all sorts of ways to participate. We do philanthropy, we do grants, we do individual donor work, and we have a fundraising council that helps us with that. And we have volunteers that help us with our events, like the fundraising luncheon you came to. We had a number of volunteers help pull that off, and it was amazing. Their support is really critical, and so those are certainly ways to engage.
Brian Ladd here. I appreciate you listening. This BendBeat podcast is proudly produced and brought to you by the Ladd Group at Cascade Haase and Sotheby's International Realty. We at the Ladd Group believe that real estate is more than just homes. It's about our community. We're deeply committed to making Bend a better place, and we dedicate ourselves to serving our home buyers and our home sellers at the absolute highest levels of our industry. You can learn more at bendpropertiesource.com, or you can always give us a call. Enjoy the rest of the podcast. I had always seen Mosaic, but obviously it had grown even during my time here. But to really understand what it was eye-opening to me. That in my impression, it was just another medical provider, and I didn't understand that essential niche that you're filling here. And it's not even niche. I mean, if you're serving 1 out of 8 Central Oregonians.
Yeah.
I guess in the absence of that service, where would those 1 out of 8 people be? How else would they be seeking medical care? How would things accelerate from prevention to crisis? What would paint the picture for us if Mosaic were to disappear?
Yeah. Well, I'll tell you one of our origin stories. So before we were here, and there was a farm worker family that came to the Prineville hospital, and a nurse anesthetist who worked there was called to help translate. And the family, they were 18 years old, had a baby that had a condition that was causing the baby to die. And the family had no supports, had no idea where to go, showed up in the ER. They helped the family as best they could. They got them on hospice, and the baby died within 24 hours and is now buried actually in Prineville. And we stayed connected with that family, but there was nowhere for them to go. And so having a Mosaic come in, they can be connected to a clinic and be getting help all along the way, right from the start of something happening.
Yeah. So otherwise it's crisis care,
Crisis care, or it's no care.
Yeah.
Because we do a lot to help people on the prevention pathway too. So prevention is so critical for our health and well-being. And when you're connected to primary care, you are able to get those preventative services or secondary prevention. So if you have diabetes, you're getting it managed and controlled, so you're not having those horrible outcomes that lead you to going into the hospital and eventually die.
Yeah.
So that being connected to a stable primary care system that has this robust resource keeps people living and contributing in the community. When that gets pulled and there's not access, people's health really starts to deteriorate. Physical health, mental health, substance use, and then that becomes part of what our community is absorbing, and it absorbs in different ways, whether it's the ER, the hospital, or sometimes even the jail system.
Yeah, and I mean, from so many, just from the humanitarian side of it, that's where it should stop and end. That's horrific. But then even just, I would think that for the financial stability of all these systems and the ER and law enforcement, things like that, I would think that it only gets more expensive and only more tragic if unserved.
Yeah, like keeping people healthy, taken care of on their journey, those systems then can do what they need to do.
Yeah.
Because they need to be there. We need an ER, but we want the ER serving emergency level conditions that were unavoidable.
Yeah.
And our ER is full, so we don't need more people going there that could have been served in a different way that would be better for their overall health and well-being.
Well, it's absolutely critical to our community, and I think it's a wake-up call for all of us, but I think especially for people that are perhaps newer to the community, to see the level of need and crisis that's within our community, and often hidden in the fringes of our community, in the forest, and in our public lands all around. I think it's one of those onions that the more you peel back, the more you realize that this is a very critical issue for everyone, and there's very few people that are unaffected by this.
Yes.
And so, there was a tragic story you just told me about that family and their child. On a positive side, do you have any stories that to help kind of create a visual for healthcare or interventions or support that Mosaic's been able to do with a particular person or family that kind of represents, the possibility of where we're going?
Yep. Yeah, I have a couple. They won't be too long, but one is this about a kiddo who had a foot deformity and he couldn't play the way his friends and siblings could play or jump on the trampoline, and the condition he had wasn't covered by his insurance, and so that was very frustrating, obviously, to him and his mom and family. So they connected with one of our community health workers who worked alongside the mom with the health insurance company and got them to cover the surgery. And then he was able to get his surgery and be able to be a normal little boy playing and having fun. And when you don't have those extra services and supports, you don't know how to work through the system to try and advocate for something that is really important for this little kiddo. And if they hadn't had that, they would have not been able to get that surgery, and it would have affected him for his life. And with these supports, we got it done. And he's okay, right? And it's just amazing. We have another patient, Elmer, who his older had a colon cancer diagnosis, and he was uninsured, and he was given an oral medication to treat his cancer that he could not afford. And he came in and was talking to his provider, and they're like, no, you need to come to our pharmacy because we have our 340B discount program. Let's see what we can do for you. So he was able to go to the pharmacy, get the medication at a very reduced cost, got some of his other medications reduced as well. So his total medication cost actually went down. And then he was able just to focus on his cancer treatment and not worry about not being able to afford it or going into bankruptcy. The number one bankruptcy in our country is medical bankruptcy.
Yeah. Well, so so why doesn't all healthcare not work this way? From the outside, and I see all the holes and whatnot, and people struggling for service. I guess, if this vision is working so well, and that you've been able to build the sustainable model over the last 25 years here in Central Oregon, what are the lessons to be learned for our medical ecosystem overall?
Well, I do feel like we have it being geographically isolated. Our Central Oregon medical ecosystem, I think, has the components that there's a lot of positives there, and we can work together to solve some of these really complex problems that other settings that don't have that ability to do, they can't do it as well as we can. So when I think about like the ACA and healthcare reform, Central Oregon came together and did some really innovative approaches to how payments worked and how care was delivered and how health outcomes were focused on. And we still are in a United States healthcare system that is very complex and broken and has a lot of challenges. It is incredibly expensive and not delivering us the outcomes that we deserve.
Yeah. I mean, when you look at just the cost of healthcare, whether it's public, private, insurance, whatnot, when you look at the total money being spent on healthcare in the United States versus the outcome, it's pretty disappointing.
It is, yes.
And so if you were to have a magic wand and say, I'm going to fix this in the system first, what would that be?
Affordability. It's not affordable for anybody.
Yep.
Like, it's really, whether it's a business having to pay these incredibly expensive premiums, it's an individual on the market trying to afford that, or it's people navigating with the cost share components of it.
Yep.
Like, it is not affordable. And we need to figure out a pathway in this country to get to where healthcare is affordable, because it's so essential for us to have our health, to be able to work and go to school and enjoy life. And that, so the affordable, if I could do the like, I would make it affordable.
Yeah. So
and accessible.
Yeah. Affordable and accessible.
Comprehensive.
And comprehensive. If what are some headwinds that you see out there given the political and if you're that reliant on federal funds, is that the scariest part of this for you right now? Or, what are some of the headwinds that give you the most worry?
Yeah, I think that there's going to be some shifts with Medicaid, which is a big part of our population and also our funding. And so we have, modeled out what some of those impacts might look like and are prepared to weather those storms. I think what I'm also very, very concerned about is that we are going to have a growing uninsured population. I think with the marketplace becoming not affordable for folks.
Yeah.
And then Medicaid shifts where people are going to come off Medicaid. Our community is going to go back to having a significant portion of uninsured patients. And
this is late 90s, early 2000s levels of uninsured patients.
And, right now, Oregon has worked so hard over the last 10, 15 years to get coverage where in Oregon, only 3% of Oregonians are not covered by insurance. That is not true in other states. So we've had this really major focus on making sure people have coverage so they can get care. When we go back to having a large uninsured population, people ration their lives, including their care. And sometimes people say, well, everyone's going to go to the ER. No, they don't go to the ER because that costs money. So they don't go anywhere. Or if they come in and they're on a sliding scale, they ration how much they come in. They ration if they have diabetes, how often they check their blood sugar. They ration how much of the medication they take. They ration when they get the screening test they need to get to see how these conditions are going. And so the ability to keep people healthy is so much harder when we don't have coverage.
Yeah, I'm just trying to digest the implications of that, but it's a scary place to be.
It is.
Um,
And it's really difficult in the communities. It's difficult in the healthcare ecosystem. It's not sustainable, and it's why Oregon had done so much work to get us to where we are today.
well, and it's not a hypothetical outcome. This is a very real outcome that we've seen what uninsured population looks like before. We were moving in a direction where that was becoming a thing of the past here in Oregon, and to go back to that seems very, very unnecessary.
Yeah.
You spoke of that gap that Oregon was trying to cover. Is that the Oregon Health Plan? Or
There's a couple programs. So there's obviously the exchange and the tax subsidies that are going away. Then there's the Oregon Health Plan. And then Oregon also expanded beyond the income limit for Medicaid and increased the federal poverty level limit to 200% of the federal poverty level from 138. So that's a population that's not required to be covered, but Oregon chose to cover.
Okay.
And then there's also the Healthier Oregon program that covers people regardless of immigration status.
And so Oregon's pretty unique in that situations. Do other states that aren't expanding that coverage, are they just a higher percentage that are uninsured?
Yes. Yep.
Nationwide, do you have any guesstimates on how many people do not have coverage?
Yeah,
but it's not 3%.
No, it's definitely not 3%. So there are a few states that are similar to Oregon, but there are a number of states that didn't expand to that level.
It's a scary time for a lot of things, but I think in healthcare in particular, I think there's some scary headwinds right now. What gives you hope right now about, at least, you can't solve everything, but like if we're to try to narrow it down to the 30,000 or 35,000 people that you're serving right now in our community, what gives you some hope about your organization or where things are going?
Yeah. Well, I think internally, I feel like the people that we have serving the community are so invested in caring for this population and will go to the ends of the earth regardless. And so I feel so thankful that I know that about the people that are a part of Mosaic. And then I think from a system perspective, it goes back to the different partnerships we have in the healthcare and the community-based organization community within Central Oregon, and being geographically isolated, we can come together readily, pretty easily, and solve these big challenges together to make decisions across our systems to best serve the community with what we have.
Yeah, the geographical isolation of our our communities has always been a challenge, but it also seems to be one of our unique strengths in being able to fix things together.
Yes.
We're close enough that we're one phone call away from anyone in the community, and they're always willing to meet. And I think the collaboration that I've seen within our community for the last 15 years has been a heartwarming thing, and it's always given me a reason for optimism in the future, despite the challenges that we've had.
Yeah, I agree.
So obviously, I want to go back a little bit because I glossed over this. When you talk about kind of that cultural calling of the people that serve and provide care with Mosaic, I think that's a big integral element into what makes Mosaic Mosaic. Why do providers choose to work at Mosaic versus elsewhere in the healthcare system? Because obviously, I would assume they're having to do more with less, and that it's a decision beyond a paycheck.
Yeah, what I hear from the providers that come is that they want to be able to serve all.
Yep.
They want to be able to have the resources and the team approach that we have to better serve what the needs are of the people that are coming in.
Yep.
And I think they like the just experience of being on a team doing this really important work for our community.
Yep.
And I think when I talk to all folks that come to Mosaic, that they hear about working somewhere that is very mission driven, and that you are together having this community impact is something that people share with me. A new employee orientation is really important for this next part of their work journey.
Yeah. Well, speaking of that, how many providers and employees does Mosaic represent?
So we have over 470 employees.
Wow.
Which is, we started with 12. So we, have evolved over the years. And I think we're, with our growth coming up, we'll probably be over 500 in the not too distant future, which is just unbelievable to me, having started with just 12.
Yeah. Are you a member of any sort of organizations of healthcare systems like yours across the nation of sharing best practices and the lessons that you've been able to learn?
Yes, we are. Every state has a primary care association. So ours is called the Oregon Primary Care Association. So that pulls all of the health centers within Oregon together. Yeah. There's also a National Association of Community Health Centers that works more at the federal level, but many health centers are a part of that as well, which is great when you're weathering storms.
Yeah. Well, I think we've discussed quite a few things about Mosaic and your role within it, and it gives me a reason for optimism, but at the same time, there's a level of responsibility that comes with kind of understanding what you do as a citizen to continue to support and speak into and share the story of organizations like yourself, like Mosaic's. And, I implore and beg people to learn more, because I think the what you're doing is so tangibly mission critical for a healthy community. I think there's very few organizations that as directly affect the outcome of the people that are living in our community as Mosaic. And I'm, very grateful for you and your employees and your organization and what you do for our community.
Thank you.
This was presented and created by the Ladd Group at Cascade Haase Sotheby's International Realty. Whether you're buying, selling, or simply dreaming about your next chapter, we at the Ladd Group are here to guide you. You can visit us anytime at bendpropertysource.com. Until next time, thanks for tuning in.